Welcome back to the Deep Dive. Today we're diving into something you might not think is super exciting, but it's really important, those medical coding guidelines for respiratory diseases. We're going to go beyond just the codes themselves and look at why they matter, especially for anyone interested in healthcare data and trends. Oh, and by the way, we've linked the Absolute Medical Coding Institute's Medical Coding Guidelines MCG manual in the description if you want to follow along.
It's way more interesting than it might sound at first. These guidelines, the ones specifically from the ICD-10-CM Chapter on respiratory diseases, they're like the foundation for how we keep track of and understand these conditions. It's not just about paperwork, though. It's about making sure everyone uses the same language when diagnosing and treating these illnesses, which, that impacts a lot of things, from research and public health stuff to insurance claims and how we allocate resources.
Okay, I'm getting it now. So it's kind of like a secret decoder ring for all these medical conditions, right?
Exactly. Let's start with a common one. You've probably heard of COPD and asthma, but did you know there are specific coding guidelines to tell the difference between uncomplicated cases and ones that are in acute exacerbation?
Oh, wow, that's interesting. So it's not just about saying someone has asthma, it's about how bad it is and what's going on right now.
Exactly. An acute exacerbation, that means things are suddenly getting worse, like an asthma attack. It's not the same as an infection, though, even though an infection could, trigger it. Now, this is important because it makes a big difference in how the patient is treated. In an uncomplicated case, they might just need their regular meds. But an acute exacerbation, that often needs more serious treatment, like even being hospitalized.
Wow. So this coding stuff isn't just some abstract thing. It's connected to real decisions about how patients are cared for. What about other conditions where these coding details are super important?
Let's talk about acute respiratory failure. Imagine your lungs just can't give your body enough oxygen. That's acute respiratory failure. And it can, be life-threatening. When you're coding, it's really important to figure out if it's the principal diagnosis or a secondary diagnosis. Meaning, was it the main reason they went to the hospital, or did it happen after they were admitted for something else?
Oh, that sounds really tricky.
hmm
How do doctors figure out which diagnosis is the principal one, especially with those really complex cases?
It's like being a medical detective, right? They have to look at the patient's history, their symptoms, and why they were admitted in the first place to figure out what was the root cause. So if someone goes to the hospital for a heart attack and then they develop respiratory failure, well, that's secondary. But if they're rushed to the ER gasping for air, then it's most likely the principal diagnosis.
Yeah, makes sense. But why is getting that sequence right so important? Does it just affect the paperwork, or are there bigger things it impacts?
Oh, it definitely has a ripple effect across the whole healthcare system. For one thing, it impacts how hospitals get paid. The principal diagnosis is, well, more important in deciding that. But even more importantly, it affects research and public health surveillance. Accurately coding acute respiratory failure as principal versus secondary. That helps researchers keep track of how common it is, figure out what the risk factors are, and even understand how different conditions, work together. And all that data, that's what helps us figure out how to prevent and treat it better.
So these codes are like building blocks to understanding the big picture of respiratory health. Okay, what about influenza? Are there any coding quirks with that?
Definitely. One key thing is telling the difference between confirmed and suspected cases of influenza that are caused by specific viruses. So a suspected case, that means the doctor thinks it's the flu based on what they're seeing, but they don't have a definite confirmation yet. Now, this might surprise you. Confirmation doesn't always need a lab test. Sometimes a doctor can confirm it just based on what they're seeing and what they write in the patient's chart.
Oh, that's interesting. I always thought a flu diagnosis needed a positive lab test. So how do they code for the different types of flu, like H1N1 or avian flu, things like that?
Well, each flu strain has its own code. It's like categories, like J09 for novel or avian influenza. Then there's J10 for strains like H1N1 and H3N2, and J11 is for influenza that's caused by, a virus they haven't identified yet. This really detailed coding that's super important for tracking outbreaks and understanding how different strains spread.
It's like a whole flu family tree that's carefully organized for research and public health responses. It's really incredible how much thought goes into this whole system.
It is. Another really interesting example is ventilator-associated pneumonia, or VAP. It's a type of pneumonia that happens to patients who are on ventilators. And the coding for that is very specific. The code, it's J95.851, that's only used when the doctor specifically writes it in the patient's chart. We can't just assume it's VAP just because a patient on a ventilator gets pneumonia.
So it's all about being super precise and making sure the documentation tells the whole story.
Exactly. And to give an even clearer picture, we also code for what organism is involved. Like, is it bacteria or fungi? Because that can change how it's treated. It's all about creating a really detailed medical history, code by code.
It sounds like a detective novel, like unfolding with every new code that's added.
Yeah.
I never realized how much these codes help us understand and improve patient care. What happens if, like, a patient comes in with one type of pneumonia and then develops VAP later on?
That's a great question. In that case, the code for the first pneumonia would be the principal diagnosis, and VAP would be like an extra diagnosis. That detailed sequencing, that helps us track how the illness changed over time, which is really helpful for research and for understanding if the treatments are working.
So each code is like adding another layer to the story. And that story helps us understand how complex these diseases really are. Are there any other conditions that have unique coding guidelines that we should know about?
There's one that's become, well, really important lately, vaping-related disorders.
Yes. Vaping has definitely become a major health concern over the past few years. So how do they code for that?
So to reflect, how respiratory illnesses are changing, there's a new code specifically for vaping-related disorders. It's U07.0, and it's used as the principal diagnosis, even if the patient also has a lung injury.
Oh, wow. So one code covers all of that. You don't have to add separate codes for lung injury or other symptoms.
That's right. It makes things simpler, and it makes sure we're accurately tracking this new health issue. We can, however, use additional codes for other conditions that are related, like acute respiratory failure or pneumonitis that's caused by inhaling fumes and vapors.
It's amazing how the coding system adapts to new health challenges.
Yeah.
This deep dive is really making me realize how much these codes matter.
They really do. Each one is a piece of the puzzle, and when we put them all together, we get a clearer picture of what's going on with respiratory health trends, which, ultimately guides research, prevention, and how we treat these illnesses.
This has been so insightful. We've covered a lot, from COPD and asthma to all the details of coding acute respiratory failure, influenza, and VAP. And we even touched on those new challenges, like the code for vaping-related disorders.
It is fascinating to see how these codes, which, they might seem like just numbers at first, they're actually telling a story about the state of respiratory health.
We'll be right back to keep going with our deep dive into the world of respiratory disease coding. Stay tuned for more.
It's interesting. All these codes we've been talking about, they're really rooted in, medical terms, right? But they also have a big impact on, the money side of healthcare, how hospitals get paid and all that.
Really? I never thought about that. So you're saying a hospital's finances are affected by how well they assign these codes?
Oh, absolutely. The principal diagnosis, remember we talked about that? That plays a huge role in how much money they get. It's like a price tag for medical care. And if it's not accurate, hospitals can really lose out on funding.
Wow, that makes you realize how important medical coders are. They're not just dealing with data. They're affecting the bottom line of these huge healthcare systems.
Exactly. And it goes beyond just hospitals, too. Accurate coding affects research funding, public health programs, even what decisions are made by, policymakers. It's all connected.
So for anyone out there thinking about a career in medical coding, what kind of stuff do they need to know? What skills are important?
Well, first of all, you need to know medical terms and anatomy, right? That's essential. But it's not just about memorizing codes. You need to be able to think analytically, really understand those medical records. And attention to detail is super important. Got to be accurate. Plus, you have to keep up with the latest coding guidelines. They're always changing.
Sounds challenging, but really rewarding. Like you're kind of a detective, right?
Yeah.
Putting all the pieces together from medical records to get the full story.
I like that. A good detective. And every good detective needs resources, right? The Absolute Medical Coding Institute's MCG manual. That's a really valuable tool for anyone working with these codes. We've linked it in the description, by the way.
Oh, right. I bet it's like the coder's Bible, full of all those guidelines and details.
Exactly. You got to have it. But beyond that, being part of professional organizations like the American Health Information Management Association, or AHIMA, is really important too. They've got tons of resources, webinars, conferences, online forums, you name it, all to help coders stay up to date.
It's like having a whole network of other detectives to talk to and learn from.
That's a great way to put it. Networking and continuing education. Those are so important in this field. The world of medical coding is always changing, new codes, new guidelines, so you gotta love learning new things.
It sounds like a career that keeps you on your toes, helping the whole healthcare system work better.
Exactly. It's a behind-the-scenes role, but so important.
So as we wrap up this section on respiratory disease coding, what's the one thing you want our listeners to remember?
I think the main takeaway is this. These codes, they're not just some administrative thing. They're how we understand, track, and ultimately treat respiratory diseases. They have a direct impact on research, on public health, on patient care, even on how well healthcare institutions are doing financially.
It's amazing to think that something as basic as a code can have such a big impact on healthcare.
It really shows how connected everything is in healthcare. From the doctor making the diagnosis to the coder doing their work, every step is important in shaping how we deal with respiratory health.
This has been such an eye-opening conversation. We've gone way deeper than just the surface of these codes and looked at their real meaning and impact. Thank you so much for sharing your knowledge with us today.
It's been my pleasure. I hope this deep dive has helped people appreciate the world of medical coding and see how important it is to healthcare as a whole.
Okay, so we've really gotten into the nitty-gritty of these codes and how they affect doctors, coders, and the whole healthcare system. But what about, the rest of us, people who aren't medical professionals? Why should we care about these respiratory disease codes?
That's a really good question. It might seem, kind of technical and all, but it actually affects everyone in the real world. Just think about it. These codes, they influence how we track if diseases are becoming more or less common, how we decide where to put healthcare resources, even how new treatments are developed. They're like the foundation for all the research and decisions about respiratory health.
So can you give me an example, how do these codes actually translate into something that affects my daily life?
Of course. Let's go back to that new code for vaping-related disorders. Now that we have this specific code, researchers can actually keep track of how many people are being diagnosed with these problems. They can figure out what the risk factors might be, and they can see if different treatments are actually working. That data is super important because it helps us make better public health decisions and, ultimately protect people's health.
So, the next time I see a news report about a bunch of people getting lung injuries from vaping, I'll know that those numbers come from this coding system.
Exactly. And it's not just vaping either. These codes are used to track all kinds of respiratory illnesses, from, the common cold to pneumonia, even those long-term conditions like COPD. And that information helps researchers understand how much these diseases are affecting people, figure out who's most at risk, and then they can try to push for better ways to prevent and treat them.
Wow, this has been a real eye-opener. I never thought something as simple as a code could be so important for how we understand and deal with respiratory health.
It's all about putting the pieces together, right? Each code is like a little piece of the puzzle, and when you have all the pieces, you get a much clearer picture of what's happening with respiratory health.
Okay, so as we wrap up this whole deep dive into the world of respiratory disease coding, what's the one thing you want everyone listening to take away from all this?
I think the most important thing to remember is that these codes aren't just numbers, they're really stories. Each code tells the story of someone who has a respiratory illness. And by making sure those stories are accurately captured with this whole coding system, well, we can work towards a future where we understand respiratory diseases better, where they're managed better, and hopefully where they're not as common anymore.
That's a really powerful message. Thank you so much for joining us on this deep dive into the world of respiratory disease coding. We've learned so much about this system and how important it is for shaping how we think about and take care of respiratory health.
It's been a pleasure to be here. And remember, knowledge is power, right? Understanding these codes, well, helps us all appreciate just how complicated healthcare is and how important it is to have good data if we want to make things better.
And to all our listeners, we encourage you to keep learning. Check out the Absolute Medical Coding Institute's MCG manual. We've got it linked in the description. And explore this whole world of medical coding. You might just find something you're really passionate about. Until next time, keep diving deeper.